active release therapy. So the ART, a lot of the stretching that we do where we're putting our thumbs in different areas, and some of it doesn't feel as good as one might hope, but it's very, very effective. And similarly to with percussive therapy, it's working on the different receptors. Oh, we use them the same color. It's working on different receptors in the muscle. Okay, and these receptors are once again signaling the brain. So all these little guys send messages up to the brain to tell the brain where the muscle is in relation to the joint, in relation to our body and all the different functions, but really the muscle in relation to the joint, so that we can give the brain feedback so it can better coordinate an output, and we protect and stabilize the joint, we don't get injured. Now it works a little differently on a little different receptor activity than the percussor does. Well, by shortening the muscle and lengthening it with pressure on these receptors, we're able to change the receptor integration, or another way to say that is how the receptors signal the brain. So it's another level of proper signaling and information that needs to reach the brain in order to best control that nerve. So it works a little differently than the percussor, but they work in context. So it's another level of information that comes into the brain to help revitalize and restore that muscle group. And when that muscle group is healthy, then that joint is healthy and the nerve is healthy, and then things start to flow and progress well. And the key is that our work is specific. So you have to be specific on these different muscles that are affected in order to really change the receptor. So the same thing with the percussor that we talk about. You know, there are a lot of units that you can use at home, but it has to be applied appropriately, and that's the key with any healthcare and medical device. Thank you.